Peptic ulcer is a basically solitary and the mucosal ulcer. So the peptic ulcer simply divided into the two types, a gastric ulcer, which is a 10% of the cases, while the duodenal ulcer is a 90% of the cases, and it is involved the proximal part of the duodenum, while in case of the stomach, it involved the distal part of the stomach. So the presentation of the peptic ulcer disease patient is basically the chronic, periodic, dull burning epigastric pain that is related to the meal and often radiated to the back and associated with nausea, hematemesis, which is basically the coffee ground emesis, or melena, blood in the stool. So the gastric ulcer pain is worsened with meal, while duodenal ulcer pain is improved with meal. Last is the physical examination. The physical examination generally normal, but it may reveal epigastric tenderness and stool goitic is a sometime positive. So now I'm going to highlight some key differences between the gastric ulcer and the duodenal ulcer. So the first important thing is the pain. The pain of the gastric ulcer is greater with the meals, and the patient usually weight loss. So the duodenal ulcer pain is a decreases with meals, and the patient is more usually obese. So in case of the H. pylori infection, the 70% cases of the gastric ulcer is associated with the H. pylori infection, while the duodenal ulcer it is a 90%. So mechanism of the gastric ulcer is basically the decreased mucosal protection against the gastric acid, while the duodenal ulcer is the decreased mucosal protection plus or may increase gastric acid secretion. So the gastrin is a hormone that act on the parietal cells, and it will lead to the increased gastric acid production. So the another cause of the duodenal ulcer is a Zollinger-Ellison syndrome, which is basically the gastrinoma where the excess gastrin production take place. So the other causes of the gastric ulcer is the NSAIDs, bile reflux. Risk of the carcinoma is increase in the gastric ulcer, so biopsy is required, while in case of the duodenal ulcer is generally benign. So the diagnosis of the peptic ulcer, most accurate test is a upper endoscopy with a biopsy. Biopsy to rule out the gastric cancer, because the gastric ulcer increase the risk of the gastric cancer. So upper endoscopy, biopsy, most accurate test. This test also used for the H. pylori infection. So it is associated with and increase the risk of the peptic ulcer and gastric peptic ulcer. To rule out the active bleeding or gastric adenocarcinoma. Next is the H. pylori test. If perforation is suspect, upright chest X-ray. So in case of their perforation of the peptic ulcer, so air under the diaphragm is diagnosis for the perforation of the peptic ulcer, and this is the emergency. A CT scan of the abdomen. In recurrent or refractory cases, check serum gastrin level, because the Zillinger-Ellison syndrome is another cause of the peptic ulcer disease, and it is the tumor of the gastrin. So more gastrin is produced and more HCl is produced, and it will lead to the peptic ulcer disease. Complication of the peptic ulcer. So hemorrhage is the most common complication of the peptic ulcer. The most common location of the gastric ulcer is a lesser curvature, and the rupture of the gastric ulcer will lead to the bleeding from the left gastric artery. This is again a high yield stuff. And the most common location of the duodenal ulcer on the interior wall, but it may present on the posterior wall of the duodenum. If the rupture of the posterior wall of the duodenum due to the duodenal ulcer, it will lead from the bleeding from the gastroduodenal artery. Obstruction is another complication of the peptic ulcer, and the perforation. So perforation is an emergency. So interior duodenal ulcer perforate and it will lead to the pneumoperitoneum, and this pneumoperitoneum is emergency. So on the chest x-ray, you chest x-ray air under the diaphragm. This is basically the air. This is air. So air under and the diaphragm will diagnose the pneumoperitoneum, and patient may present with the shoulder pain, referred pain to the shoulder because of the irritation of the phrenic nerve. So the treatment of the peptic ulcer divided into the two part, acute management and the long-term management. So acute management, you mainly manage the emergency like perforation, confirm on the CT scan, then surgical repair of the perforation, and identify the bleeding and then treat the bleeding. So in case of the long term, is a further divided into two types, a medical therapy and the surgical therapy. So medical therapy, the aim of the medical therapy to protect the mucosa, decrease acid production, and treat the H. pylori infection, while the surgical therapy is basically the parietal cell vagotomy. So the parietal cell is the main culprit to produce the gastric acid HCl. If you surgically treat this condition, it will help the patient.